Hello, I'm Crystal Odell, and I'm the Program Director for the Nurse Anesthesia concentration at Lincoln Memorial University.
Hello, I'm Joy Goins, and I'm the Clinical Coordinator for the Nurse Anesthesia program at Lincoln Memorial University.
But more importantly,
we are Tennessee CRNAs.
To begin with, what is so important about being a CRNA? CRNAs have been providing safe anesthesia care for over 150 years in the United States, and annually we provide about 50 million anesthetics.
Numerous studies have demonstrated that there is no difference in the quality of care provided by CRNAs and their physician counterparts, regardless of practice setting.
And one of the practice settings that we practice in is the rural setting. In rural areas, CRNAs are about 80% of the anesthesia providers. Many rural hospitals are what we call critical access hospitals, which can rely on independently practicing CRNA for viability. Half of the U.S. rural hospitals use what we call a CRNA-only model for the provision of obstetric care. And CRNAs safely deliver pain management care, particularly in these areas because there may not be one of our physician colleagues available to work there. If it weren't for us working in these areas, there would be no surgery, there would be no labor and delivery, there would be no trauma stabilization or interventional pain management. Without these services, the rural hospitals would not exist or could not exist. And without our local hospitals, the viability of our rural communities would be at risk.
In Tennessee alone, 26 of 57 counties rely exclusively on CRNAs for anesthesia services. Tennessee covers 41,217 square miles with a 2019 estimated population of 6,829,174 people, with 1,524,020 people living in rural Tennessee. The quality of health of Tennessee residents is dependent on access to health care. OB alone requires 24-hour-a-day coverage for anesthesia care. Also, emergency surgical management and labor analgesia. To be able to provide these important services, CRNAs receive extensive training in regional anesthesia. They receive didactic and laboratory training in things like epidural pain management, as well as a hands-on experience during clinical training. I'd like to introduce two of our nurse anesthesia students now. This is Jacob and Star.
Hi, I'm Star. I'm a senior SRNA here at LMU. And prior to going back to school, I worked as a pediatric ICU nurse at a level 1 trauma center here in Tennessee.
And my name is Jacob Bolin. I'm a junior nurse anesthesia student. Prior to coming back to school, I worked at a level 1 trauma center for about 3 years as a nurse.
All right. So I kind of already got a lot of things set up, so we'll get our sterile gloves on and then we'll get started. So sterility is important because we're going into that epidural space. So this is sort of what the basic tray looks like. First thing I'm going to do is open up, get that soaking. Alright, next thing we have is, I was telling you earlier how we have our saline, so I'm just going to open that away from the field. And then our lidocaine with epi for our testis. And I'm going to go ahead and use a filtered needle. So since these glass ampules, we use the filtered straw so that we can ensure that we don't get any particles. So we're going to go ahead and clean the area. And I like to just work my way out. And so you don't have to go very far width-wise, but I do always ensure that I cover another space below.
And one of the reasons she does that is we do it all by feel. We're not seeing where the needle goes. We do it by feel of the bones. And so if she needs to move and start the epidural in a different space, she's already has it cleaned and ready to go. This helps her protect the part that's not been cleaned from the part that's cleaned, again helping to prevent any infection.
And we'll bring our thumbs together here, and we should be in the L4, L5 space, which is usually the largest. But we can also run our thumb down the middle of the back here and we'll feel that indentation.
And it's important to remind the patient that your spinal cord stops about L1, L2, And so we work below that so there's less risk of spinal cord damage.
Next thing we're going to do is do a skin roll. So we're going to numb the area that we're going to be inserting the epidural, and then we're also going to go a little bit deeper. So you're going to tell the patient they're going to feel that sting, and we go in just below the skin, numb that up real good. And you're going in different directions, but I always like to numb really well and advance through that area I've already numbed.
And now the area is numb and she'll be able to insert the larger needle.
So I always let the patient know that they are going to feel a little bit of pressure, as well as if they can tell me if they start to feel any pressure on a certain side, and that can help me redirect where I need to be.
This needle is hollow, so once she gets in the location she needs to be, we're able to thread a catheter. That catheter allows us to insert local anesthetic near the nerves so that we can make the pain transmission be blocked. And the epidural space is a potential space, so what she's looking for is a sudden loss of resistance so that she'll know she has entered that space, and then she'll be able to successfully insert her catheter.
So once I know that the needle is anchored, I start advancing until I feel loss of resistance, and I like to do it in thirds. So insert, tap, and here you can see that I feel loss of resistance because it's easy to expand the potential space.
This is the little thin catheter will remain in the epidural space during the patient's labor, and this allows us to provide additional medications as needed, and it can also be for emergency anesthesia management if the patient would have to go have a cesarean delivery. So she's going to put a cap on, and then she will secure the epidural to the back, and she will provide testing of the catheter, make sure it's in the right location, and provide pain management for our patient. And that is essentially what an epidural is. That is a very good job, Star. Thank you very much.
Thank you.
And this is just a glimpse into the training CRNAs receive to be able to provide confident, cost-effective, safe care for Tennesseans.